So, Pat, if this blows up, I mean, it's going to overwhelm the hospital system. There's a huge difference between, say, 75,000 people getting sick eventually and 75,000 people getting sick all at once.
Well, that's exactly right. And that's what a lot of people are very worried about. If everybody suddenly gets very sick, it will totally overwhelm and blow out the hospital system. 688 is the number that people should be thinking about. That is the number of ventilators that we have statewide. And the sickest of the sick are going to need those ventilators. So if we have 8,000 people or 10,000 people really sick all at once, that's a huge problem.
Now, not everybody is going to need a ventilator. Maybe they're going to need a hospital bed.
Yeah.
Where does Oregon stand when it comes to that?
Well, a lot better. There's about 6,000 hospital beds statewide. So we do have more capacity there, and they can set up tents and have a little bit of a surge capacity as well. But the ventilators is really the pinch point in all of this. They're asking for more of those from the federal government. They've not come in yet.
So the other thing I wanted to ask you, because I've heard this phrase, health officials want to flatten the curve.
Yeah.
In regards to this outbreak. What exactly does that mean?
Well, it's sort of like a bell curve where it comes in flat and then spikes up and curves and then goes back down. So they're trying to have that spike not be as steep, have it spread out over time. And they really think this social distancing and the banning of the big crowds can do that. There will still be thousands and thousands of infections, they believe, but they'll happen slower instead of all happening at once. And so you flatten the curve and you really ease the impact on the healthcare system.
So we need to take the precautions now so we can have an easier time crossing fingers a little bit later.
Yeah, and it is scary. And that's why they're banning, why the soccer games and all that are canceled. It's not that everybody's going to get infected right there and drop over dead. It's that they're going to go home and maybe infect somebody who is next to an elderly relative who may be on a ventilator.
You're absolutely right. Thank you so much for that perspective.
You bet.